Good afternoon, folks. I'll give you a moment to get connected to the audio and get situated. We'll get started with our conversation for Caregiver, a love story, in just one moment. Thank you all for joining us. I'll start with just some housekeeping and let you know what's going on and what's coming up. First of all, welcome. I'm Isaac Zablocki. I'm the Director of Film Programs at the JCC Manhattan. Thank you for joining us. We're really proud to present this film to you today, the conversation for the film Caregiver, a love story, and we hope you'll enjoy the conversation. If you have yet to see the film, of course, the film is available all week, so you can check in on our website for that screening and more. Next week, actually starts on February 12th, we're going to be hosting a virtual cinema of the film Leona, and we'll have a conversation with the director on February 16th, which is the Tuesday night at 7:30 p.m. A fantastic film about a young woman considering to convert for her Jewish boyfriend. Later this month, we also have the film The Vigil, which is coming up, actually a Jewish horror film in Yiddish, mostly in Yiddish. It takes place here in New York. Don't miss that, if that's your cup of tea. We also have, it hasn't been announced yet, but we'll also be hosting a virtual run of the film Till Kingdom Come, which we presented at our Israel Film Center, at our other Israel Film Festival earlier this year. That's going to have a virtual run and much more coming up. Also, of course, in connection, I'm going to connect Caregiver, or Love Story to our ReelAbilities Film Festival as well. Which will be this year, April 29th till May 5th. So mark your calendars. And we also have other ReelAbilities screenings throughout the year, including a film that's available right now, The Reason I Jumped, which you can view through Kino Marquee as part of our virtual cinema page there. So you could check that wonderful film out. It's about a young boy with autism who writes a book and explains what is going on in his brain. He's otherwise nonverbal, and just a beautiful film in general, exploring the world and the minds of young people with autism, I would say. And I think that's all I had for upcoming programs. And now it gives me great pleasure to move to our headliners today. So we're pleased to have here, first of all, a wonderful partnership came into place for this film, and that is with the JCC's own What Matters program. And one of the key pioneers of this program, Lois Perelson-Gross, is here with us, and she will be moderating this conversation and can tell you a little bit more about the program. She's going to be in conversation with the director of the film, Dr. Jessica Zitter, and we'll introduce a little bit about how she got involved with her as well. If you have any questions, of course, please place your questions in the chat, and we will open your mic if the question is relevant to ask that question live. And now I'll hand things over to Lois. Lois, over to you.
Thank you so much, Itzi. I'm so very happy to be in conversation with my amazing friend, the extraordinary Dr. Jessica Zitter. Jess is an ICU and palliative care doctor. She's an accomplished author. She's the producer of today's film. She's also the subject of a 2017 Oscar and Emmy Award-nominated film Extremis, which is now streaming on Netflix. It's a short documentary. This Extremis follows Jess and her team and several patients and their families in an intensive care unit at Highland Hospital in California. Jessica's must-read book, Extreme Measures, Finding a Better Path to End of Life, offers an insider's view of an intensive care unit in America and how we die. Extreme Measures is one of the very best books available on end-of-life care and decision-making. Just a bit of personal information, full disclosure, I am a co-executive producer of this film, along with Jessica's and my very dear friend, Dr. Jeannie Blaustein. And Jeannie and I are also instructors and facilitators in the What Matters program, which co-sponsored this event. What Matters, for those of you who don't know, is a program of the Jewish community of New York that encourages individuals to engage in advanced care planning. Through one-on-one meetings and group sessions led by trained facilitators, the program helps individuals thoughtfully consider and document their individual preferences and their individual healthcare preferences, and select appropriate healthcare agents who can speak for them if they're unable to speak for themselves. Individuals are helped by our facilitators to complete their advance directives and supported as they communicate their wishes to important people in their lives, to doctors, to lawyers, to family and friends, with opportunities to engage in Jewish values as part of this process. Now in its 6th year, What Matters operates at 20 different sites. We have more than 80 different facilitators, and we are most grateful for our support from Plaza Jewish Funeral Home, UJA Federation, and through the JCC throughout the years. So, a bit more about Jess. After 2 decades of caring for critically ill patients, Jessica is a strong advocate for a new approach to caring for the dying. As I noted, she specializes in critical care and palliative care medicine. Having herself participated in the default and indiscriminate use of technology on dying patients with its resultant suffering, Dr. Zitter has come to view this situation as a public health crisis. She's committed to reorienting our care of the dying to a more collaborative process whereby the patient, rather than her organ or disease, is the primary focus of care. Jessica describes herself as an accidental activist, one of her many titles that I love, and this film is one way in which she's fulfilling this role. So as most of you know, Caregiver, a love story, examines the rising health crisis of caregiver burden. If you've not already seen the film, I absolutely urge you to do so. So Jess, how did this film come to be?
Well, first of all, thank you for that amazing and glowing introduction. And thank you to you for being one of the early supporters of this film, and to What Matters for being incredible advocates for the work that I care about so much as well. And the JCC for hosting us. How did this film come to be? Accidentally. It wasn't actually supposed to be this topic or this film. This film came to be when Extremis and my book, which both came out in early 2017, were kind of getting ready to be released. And my friend Bambi, who you see in the film, who is this dynamic, wonderful, brave, thoughtful person, had this experience that you see in the film. And she actually invited me in to come and document it because she knew that I was a writer, and she knew that I was interested in film as a way to spread the message about advanced care planning and about how we think about things. And she was having this very positive transformation of her life as she decided to come home and focus on quality of life and on hospice. And so she said, come on in, write about me. You can film it. If it's going to help somebody else, wonderful. And so we came in and started filming. And to be totally honest, I didn't look at that footage for about a year, until about a year after Bambi died, because I was busy and I hadn't. And then I found this amazing co-director, Kevin Gordon, who came in and just took the footage that we had and tried to see if there was a story there. And he put it together, and it was so shocking to me and so powerful when I first watched this rough cut to see that the story that I thought we were going to tell, which was about having a good death at home and a powerful sort of self, this person making the decisions and planning and having this good experience, that it actually wasn't really about her. And it wasn't about dying at home. It was really about the experience of this caregiver, something that I had not had any sense of until that moment, and which is in and of itself an interesting and surprising and concerning reality. If I don't know about this issue of family caregiver burden, who else doesn't?
Thank you for that. It was, I remember the process, and it was really an extraordinary one for you and for all of us around you who are privileged to hear about it. So what do you want us to understand about first and foremost about Bambi and Rick's experience, and then I'd like to follow on for that. How could the whole situation have been better for Rick? That's a lot.
No, it's a good. I mean, it's an important question. The thing I think that's most important to realize is that Rick was one of the lucky ones. Talk about putting context to this crisis. You watch this film, it's moving. You are hopefully mobilized or motivated to learn more about the issue. Your awareness has hopefully been raised about this issue that's an invisible, really an invisible public health crisis. And then hopefully you'll be, motivated to say, we've got to do something about this. With all of that emotional mobilization and motivation, you have to understand that that was just the tip of the iceberg. Rick's experience was one of the easier ones that caregivers have. Rick only did this for 9 weeks. The average caregiver does this for 4.5 years. Rick had some savings that he could live on for those 9 weeks. A very large percentage of people use up their savings with caregiving, which is a very expensive and unreimbursed activity. I think $465 billion of work are uncompensated in this country. All of this work of caregiving is essentially totals $465 billion, but no money is changing hands. And these caregivers are essentially running on fumes, emotional, physical, and financial. So your first question was, what would I want people to know about Bambi and Rick? I think understand that context. Understand that 1 out of 5 Americans is a family caregiver. That's 53 million people. This is a large number of people, and it's growing. The proportion of caregivers is going to grow because why? We have demographic shifts. We have smaller families, more baby boomers, prolonging life with medical technology. So more people living with disability and disease for longer periods of time. More families scattered across the nation, more debt, more divorce. All of this is a formula for increasing pressure on these family caregivers. So this is a public health crisis that has to be noticed, and something's got to be done because it's not sustainable.
Jess, that you make such important points, and the numbers are so staggering, and this film is so important in conveying that really in a very personal way. What did you want us to understand about hospice from this film? As you and I have discussed, hospice is more often than not the path that healthcare professionals choose for themselves and their loved ones. It's the most patient-centered option. In Caregiver Love Story, we see the extent to which hospice can also be a most challenging labor of love. Can you say more about that?
This is such a critical point, Lois. It's so important. When this film first came out, when we first started editing the film, and you saw some of the early cuts, and we had lots of conversations about this phenomenon of, oh my goodness, we have to protect hospice, because we all know that hospice is the best thing that we have, and it is wonderful. It is a wonderful service. And by the way, the hospice in this film did a wonderful job. Bambi would never have been able to be home without that hospice. But what do? We want to find a reason, something to blame for Rick's experience. And so when people watch this film, they say, well, why wasn't hospice there more? Why didn't hospice do this? Or why did his sons fly back to Israel? There's some need to look for a solution. Well, if only hospice had done more, and so a lot of people like me who care about hospice and who know that it's one of the best things that we have, were worried. What if this film looks like it's throwing hospice under the bus? And it was one of my biggest goals not to. And so at every moment, I take every opportunity, and thank you for giving it, to remind, to really say, this is a moment for us to face to get rid of the myth about hospice. Hospice doesn't do everything. Hospice doesn't change diapers. Hospice doesn't do shop for groceries and do laundry. That's not what hospice is. Hospice is being paid about $150 a day to provide durable medical equipment, to have a palliative care team. And by the way, palliative care is not hospice. We'll talk about that differentiation in a second. But to have people who are very expert, a whole team of people who are expert at enhancing quality of life, to manage symptoms and try to make sure that the biggest pieces of this are taken care of, so that then the patient can be home. But hospice is not there to do a lot of this housekeeping and supporting activities of daily living and hygiene. That's not hospice's job. And I think the sooner that we as a society start to be realistic about what needs to be done when people come home and understand who is assigned to do it, we're going to be much more likely to go and get the actual realistic solution. So that was a long-winded answer. Did I get most of what?
Yeah, it was an excellent answer. I'd love you to talk a little bit about the distinction between palliative care and hospice.
Yeah. Hospice is a small subset of palliative care. Let's just start with what the bigger point. What is palliative care? Well, to palliate means to manage and support people in their symptoms and suffering, to try to mitigate suffering and maximize quality of life. And palliative care teams, which consist of this interprofessional mix of expertise, chaplaincy, spirituality, social work, obviously healthcare, nursing, we come together and look at people with this very nuanced 360-degree perspective, which is not something you see typically in medicine. And our job is to maximize the experience and the quality of life of the patients that we come into contact with. Many of our patients are not dying. Many of our patients will live for months, years, decades. And much of what we do is very aggressive. We sometimes are the people advocating for more interventions if they're going to be ones that are going to make somebody feel better or live, or sometimes live longer. And so this idea, palliative care, unfortunately, has been kind of clumped in with hospice. Hospice is this subset of patients who will benefit from palliative care treatment, but they are dying. They have been determined to be dying by their doctors, and that's when you qualify for hospice. You don't qualify for hospice if you are not considered to be less than 6 months away from death. But the people who will benefit from palliative care, many, and probably most, are not 6 months away from death. So that linking of the two is a really important. It's important that we decouple it, because what's happening is that because of that sense that people have, oh, palliative care is hospice, a lot of people say, I'm not ready for palliative care. Of course you're ready for palliative care if you need attention to suffering and if you need help maximizing your quality of life. You don't have to be dying.
That's such a great explanation. And there's, as you know, so much confusion or a misunderstanding about both. And making the distinction is really helpful for all of us. So as you know, I approached the film with a particular focus on advanced care planning as an instructor and facilitator in the What Matters program. Advanced care planning really might be the most all-encompassing theme of the film, in my view, because caregiver burden and the hospice experience come about because Rick is ultimately honoring Bambi's greatest wish to die at home. That was her advanced care plan. Can you talk a little bit about this?
Yeah. Yes. This film made me realize how narrowly we think about advanced care planning. When I think about advanced care planning, as somebody who is an ICU doctor, I think, well, do you want to be on the ventilator, or do you not want to be on the ventilator? That's one small, how you want to be treated in the hospital in terms of life-prolonging treatments and therapies. Of course, that's an important part of advanced care planning. Thinking about whether or not it would be acceptable to you to live for any period of time on breathing machines, especially if they were unlikely to restore you back. Those are very important types of advanced care planning. But it's really, really critical to remember that advanced care planning also includes other things that are not just hospital oriented. They include things like, well, what are we going to do if you do come home with hospice? Who's going to be there? How are we going to manage the groceries? How are we going to keep the fridge stocked? That's a type of advanced care planning too, and we're not thinking about it that way. And so, after really, it was kind of funny because it's only recently, about 2 months ago, I said to my mother, let's talk about I actually said to my sister, what are we going to do when our parents need support? We better start thinking about that. Who's going to help? Where are they going to live? Are they going to be in our house? Are you going to take we need to be doing that kind of advanced care planning as well. And then there's all sorts of other types of advanced care planning as well. Like, for example, in my book, one of the stories is called Goals of Hair. It's not goals of care, it's goals of hair. And it was a story about a friend of mine whose mother was dying on hospice. And one of the things that had been critically important to her that she had communicated to her daughter was that she did not want to have a hair on her chin ever. And so her daughter knew that her mother was now unconscious, and she said, I need to honor that. And so, I mean, that sounds like a trivial thing, but these are the things that make us who we are, that allow us to exhibit our values and live our values all the way until the end. And so all of these things need to be considered.
Thank you. That's such a broad and important way for us to think about advanced care planning. I want to drill down a little bit more on it, and also just note that Jessica and I are working on a project called "The Doctor and a Rabbi Walk into an ICU," and one of the stories in that, it's a graphic novella, and one of the stories is called "The Goals of Care," based upon Jessica's wonderful and really profound telling in the book. So stay tuned for that. In a absolutely beautiful and compelling op-ed that you wrote in the New York Times that was published in April of 2021, entitled "COVID or No COVID, It's Important to Plan," you write, "So many of us have intentions of one day writing out our plans and instructions for end-of-life care, but most of us put that task off for when we're older or sicker. But the truth is, none of us knows when we'll die. As the proverb goes," and I quote you again, quoting the proverb, "the best time to plant a tree was 20 years ago. The second best time is now." In other words, you emphasize the best time to engage in ACP is when you're healthy and sound of mind. So let's talk more about this profound proverb.
Yeah. You know, it's the human, it's the human condition to try to think about survival and positivity, and not to think about the other pieces. That's why, you know, so many people really don't necessarily insure themselves that well. And I think what I see when I'm in the hospital is the results of that. And it's not just the hospital, by the way. It's really everybody. It's all of my relatives and friends who are, you know, highly educated, highly accomplished people who haven't really thought about the possibility that they will need to plan for the stage of life. And watching the scrambling, I mean, I am probably on the phone talking to family or friends twice, maybe 3 times a month about someone who's seriously ill. And these families, again, there's been no conversation. This is such a ubiquitous problem. And they're not helped by the fact that there's poor communication in hospitals. So when things are getting very, very stressful, and certainly COVID adds a whole level to this because everyone's terrified and everyone's frantic and scrambling, there just isn't any conversation about planning. And so there's this, what I call end-of-life conveyor belt phenomenon that happens as soon as you get into that hospital environment. It's just almost too late to plan. And so it's very important that people start these conversations earlier. And so when my cousin called me for this article, COVID or No COVID, my cousin called me from LA and she said, "What if something happens to my husband and I, will you come down and get my kids?" And she was shocked that she was even having this conversation with me, but that's a conversation that needs to happen. Who is going to come and get your kids if you and your husband get sick? You live down in LA by yourselves. You got these 2 little boys. Like, what's going to happen? Your parents are 80 years old. Is it safe for them to fly on a plane? So it was so great that she reached out to me and said, "I think I need to figure this out." And it was, you know, I used to have the tendency to say, "Oh, no, Rachel, of course not. That's not," but no, that could happen. Yeah, Rachel, that could happen. So let's talk about it. And it was productive. We made a plan.
So important. And I think stressing that this is a conversation that we need to have. I mean, adults 18 years or older should have their advanced directives signed and executed. And you know, just again, what matters is a great way to have these conversations. Sally Kaplan, our phenomenal director, put in the chat, for those of you who can get to the chat, the website for What Matters, and you can sign up for a conversation and learn more about what we do. Because what people don't realize also, and comes from my experience as a facilitator of these conversations, is they are the most precious opportunities we can have with our loved ones. We get to talk about what's most important to us in our lives. And they're not grim. They're often filled with laughter and with deep love and sharing that we don't have the opportunity to do unless we really carve that out. So it's a gift on so many levels that we give our loved ones when we have these conversations. I just can't emphasize that enough.
And Lois, the other thing it does is it gives you a certain amount of peace and comfort and calm, because you've had that conversation, you've opened up that door. You can continue those conversations as time changes and things go on, but you've had it, and you sort of have this feeling of openness in your family or with your friends of being able to really talk about tough subjects that you may not have been able to do.
Absolutely, such a sense of peace in knowing that and it's quite remarkable. I want to also return to the film. You've described it as an impact film, and I'd like to talk to you more about your wishes for its impact, and who are the people and institutions who can fix this problem, and what can we do as a community to help caregivers. For a few questions.
No. That was, I'm really glad you asked that. This so important to me that this, again, based on my own personal experience of having been awakened by my own film, which is a very weird experience, I have to tell you. I feel like just like I was awakened by my own experiences as an ICU doctor, and then I was awakened by the palliative care movement to say, oh my gosh, you know what? There is this other perspective. I really want to make sure that this message, this awareness, gets out to all of the types of people who will be able to have a hand in improving this. Obviously, the family caregivers themselves. We were actually funded to create a program that embeds the film for family caregivers. And we've just finished piloting it. We're just actually writing up our report. And it was a very impactful program. So that was exciting. But you think, okay, well, family caregivers are the obvious first audience. But the fact is, you can help individual family caregivers get empowered and feel better. But if the systems around them are still not working, you've got a problem. Okay, if you don't have enough resources, if your doctors and nurses and healthcare teams and hospices aren't necessarily paying attention to the family caregiver and identifying them and figuring out if they can do more to help them, if your employer environment is not supportive of family caregivers, if your legislators aren't aware of the problem of family caregiver burden and aren't making policies that are going to improve the lives of family caregivers, if your healthcare insurers, the payers, are not paying, are not diverting money to supporting people in that non-hospital, non-institution, in the home environment, how are we really going to make any traction? So yes, the family caregiver program is important, but I'm also creating programming for medical students, medical residents, hospices. We just got a grant to create a program using the film for hospice staffs to watch, to raise their awareness and to have them do their own internal thinking about, well, what little things could we change to improve the lives of the family caregivers that we interact with? I'd love to get this, if anyone wants to help me get this in front of Congress. I think this is an issue that legislators of all stripes will be moved by. It's not something that just Democrats are going to be impacted or just Republicans. It's all of us. This is all of us. So I think there's a lot of different stakeholders here that need to know. I think that could be helped by watching this film. We all know, Lois, the narrative medicine movement, showing rather than telling or teaching, but showing people the experiences can be very mobilizing. And I think if we can get this short film in front of a lot of these different audiences, maybe we could actually get some traction.
We need to get you in front of a lot of audiences too, because you're such a compelling spokesperson for this incredibly important and really dire situation facing our country, and increasingly so. We also were talking about how COVID, you and I, changes the picture for caregivers, and I'd love you to talk a little bit about that as well.
This is what's interesting about COVID. COVID is sort of like putting a magnifying glass on life, because all of the things that COVID is bringing out, both in terms of advanced care planning that we just talked about, right? The fact that people really need to say, oh my gosh, COVID, it's really here. Maybe I do need to do advanced care planning. Same thing for family caregiver burden. Family caregivers are struggling with COVID. It is exacerbating their already stressed lives, because you can imagine all the adult daycare programs are closing down. You can't bring help in from outside anymore. Family and friends who used to come in and help in some way can't come. So these caregivers are under so much more pressure than they were. But COVID, it's a stress test on our system, but it's really showing us what's already there. COVID is just an exaggeration. And I think it's an opportunity, because my hope is that with this new transparency, with this, again, magnifying glass on what these issues that are already happening, maybe there will again be an opportunity for people to start being mobilized to say, hey, wait a minute, you know what? Maybe I do need to do some planning.
Thank you. We have some great questions in the chat, but before we move to that, I just want to offer you the opportunity to talk about any other parts of the film, or any parts of of your work as it relates to the film, or as it relates just to what's going on in your world that you want to share with this audience.
Well, the first thing that comes to mind is talking about Rick and Rick's experience with having been part of this film. And someone asked me this recently at a screening, how's Rick doing? And the thing about being in this film for Rick was that I've watched this man, who I've known now for many years, obviously, go from having felt obviously profound distress and pressure to feeling like the hero that he is and was, and feeling validated, and feeling that his work was not done in vain. And I kind of wish that we had the film to show him when he was being a caregiver, but obviously that couldn't have worked. I think that my hope is that as we see the heroic work that so many caregivers are doing, and by the way, again, most caregivers aren't caring for the love of their lives that they just met a few years earlier. Many caregivers are doing this with less of that type of limerence in their lives. A lot of it's difficult relationships. It's people who had parents who didn't accept them or who may have abused them. And there's many, many types of caregivers and caregiver situations here. And I think if we can really start to honor this work, not only will we make it more tolerable and more supporting for these people who are doing this work that is so much the fabric of our society, but we will improve our own abilities to be the support to those people. And eventually we will be those people. So I think having just this ability to change the way we think about this work and to value it and to lift it up the way it deserves to be lifted up is something that I'm really hoping we can start to do, and take away the shame of frustration, or this wasn't what I thought, I'm ready to move on and I'm exhausted. Those are normal responses to a situation like this. And we need to, instead of shaming people or having them feel ashamed about having those feelings, we need to support them and provide them as much support as we can, and also acknowledge those feelings as normal.
Absolutely. And elevate the role.
Yeah,
for sure.
Yeah.
So I think we are going to turn to Jess. I don't want to cut you off before.
No.
But, I think we turn to the wonderful questions that we have that C is going to share. Is that right?
Yep, I'll take it from here. Thank you. Thank you both. We have a question from Marsha. So Marsha, we'll open your mic and you can ask your question.
Okay, can you hear me?
Marsha.
Hey, Jessica. Hi, Lois. So I've been wanting to ask this, Jessica. This is the second time I've seen the film, the first time in its finished version. But there's another story going on about caregiving, and it's kind of in the background, and yet for many people, I think it's in the foreground, as it was for Rick and Bambi. And that's the fact that Rick is taking care of his 3-year-old granddaughter. And so I know that many people do take care of a young dependent child as well as a parent or a partner. So in a way, I think that's a very common story. And in a way, I have a 3-year-old grandson, and that is a full-time job. So could you talk a little bit about the larger issue and the smaller experience and your decisions in the film around that issue?
Well, thanks, Marsha. Of course, that is another subplot. In fact, it's a moment of suspense, when she comes into the picture and you're like, oh my goodness. And you always hear gasps in the audience. Oh my goodness. That, again, like I was saying, COVID is putting a magnifying glass. That sandwiching of caregiver responsibilities is not uncommon. I mean, Rick's was obviously right. I mean, there's just so much going on with his life. He's got this dying wife and this 3-year-old granddaughter, and just so much. You can't even imagine how he gets through day to day. That is happening to caregivers all over, all the time, pre-COVID, post-COVID. There is this sandwich generation concept that we hear about, people who have a parent who needs support, and they also have young children or teenagers or even kids in their 20s. That there's a lot going on, and so these multiple responsibilities for caregivers is a very important thing to understand. One of the things to realize about caregiver burden, like every other social crisis in our country, is that the people who get hurt the most are people of color, women, people of lower socioeconomic status, the people who tend to get impacted by most of our crises. And we know that, for example, African-American caregivers are much more likely than white caregivers to be taking care of more than one person at a time. Sometimes it's 2 parents, sometimes, but we also know that African-American caregivers are more likely to be being active caregivers while also being enrolled as students. I mean, there's so many multiple pressures of life that come down on people with caregivers, with caregiver burden. And what we're seeing, and it's particularly, there was an article in the New York Times, I don't know, about a month and a half ago, about women and caregiver burden. First of all, women make up 2/3 of the family caregivers in this country, and of course are half the population. So, it's not a surprising statistic, but it nonetheless is one for us to pay attention to. And women are leaving the workforce at a rate 4 times that of men during COVID. In fact, this writer was calling it a she session, and talking about how the impact, the sort of professional impact on women, is going to put women back 10 years in terms of their careers. So these competing responsibilities are a part of the caregiver experience, and when you really stop to think about it, they're just profound.
Thank you. We have a question from Scott. Folks, if you have also other questions, please put them in the chat and we can call on you. This is a fascinating conversation. Scott, you're on the air if you unmute.
Thank you so much. And thank you so much for your work on this film and your eloquence and work on the whole large system. I want to focus a little bit more narrowly. Probably everyone on this call is very plugged into these issues. I'm a newly trained What Matters facilitator and getting ready with our folks at my synagogue, which is a tight-knit community with lots of people who are caregivers, people living with mom and all of that. And I'm excited to I found learning the program just personally taking the pressure off about the anxiety. Recently though, my dad we had a great fire drill. My dad had a micro stroke. He's fine. But he woke up and had blurry vision and got himself to the hospital and contacted us afterwards by several days. And we talked through the immediate issues. Then I said, this is a great fire drill. What happened if you woke up and couldn't move or somebody needed to be there? And could we talk about that? And by the way, I've just been trained in this program and maybe this, would you let me practice? Like, let me take the pressure off you, do something for me. He shut it down fast. He did not want to participate in any formal program. He has isolated himself from community, and it's a real slap in the face and makes me tentative and careful as I go to my synagogue community to say, we're opening up this process, knowing that there's not just ignorance, but there's active denial. There are people setting up walls about facing this, even that you get, oh, I know I should. Yeah. Please get out of my face. And so I'm wondering if you have any thoughts about that line from the bubble we're in, where we're attending to the issue and wanting to do something about it, and the people who are pushing back. You talked about the shock when somebody was having that conversation and crossed that line. Do you have thoughts? What's the marketing pitch? What's the point at which we can assess, oh, this is a good place for me to put my effort? Or do we just have to throw ourselves against the wall and hope somebody sticks?
That is an excellent question. And I'm sure all the What Matters people have are thinking of things too. But it's a really, you're never going to bat 100. Or is it bat 100? I don't even know what the thing is. Okay. You're never gonna get everybody. I will tell you, as somebody who does this in hospitals, where I do this all the time, and I'm telling you, all the friends and family who call me constantly, oh my gosh, Jessica, what do we do? Even those people who are seeking out my support, they don't necessarily want to hear me. They want me to talk about the ICU issue, what next trial, and what should we, when I talk to them and say, hey, I'm listening to this story, and granted, I'm 3,000 miles away, but I'm really concerned. A lot of people don't want to hear that. But you know what? I've learned that I still have to say it. I still have to introduce it. There will be people, including, by the way, my own father, who will not talk to me about it. You can't get everybody. You can't get everybody. You just have to keep trying. One thing we learn in palliative care is skills, and I'm sure you learned this in the What Matters program, skills for how to be as unintimidating as you can, and how to get in there and let the person kind of guide you in there and bring you in there with them to have this conversation. There are techniques. It's a skill like any other, and you build it and you get better at it as time goes on. But there are always going to be people who don't want to talk to you about it. There are always going to be people who are going to get angry at you. There are always going to be surgeons in my hospital who say, don't let the palliative care team come to this patient. This is just part of the reality of doing this work that is taboo, and that in American culture, we often think, there's always some other cancer drug that's going to come out. Cancer Treatment Center of America is going to do something for me. We're living in that culture. And so all I can say is keep doing it, keep getting better at it. Don't give up. And you are going to have a lot of reactions that aren't always exactly what you would want, including from your father, because I know.
We have a question from Irene. Irene, you're on.
Can you hear me?
Yep.
It was so, the film was just, it had so much in it. What stood out, one of the many things that stood out for me was the awareness of how, I know how high hospital costs are. And it just seemed to me that if Bambi had been in the hospital during this period of her life or her dying, I assume that the hospital costs would have been exorbitant.
Of course.
And yet she's saving the healthcare system so much money by being at home during this time. It just would stand to reason that some of what's saved by healthcare costs in one place would be able to be used to augment, to support Rick in his care of Bambi at home.
Send that woman to Washington. You're right. You're 100% right. It is just logic.
Yeah.
I can't tell you. Let me tell you, how many times do we send patients home with hospice from the hospital, and then they quote unquote de-hospice. They bounce back into our emergency room because their caregiver needs were not attended to, right? They had a hospice, usually a very excellent hospice, but like Rick and like all the people who watch this film, where was hospice? Well, those patients, you know what happens? They come back and bounce back into our hospital, very sick, very uncomfortable, right? Because they're just not, and they never want to go back out again. And when in fact, they would have gotten better care if they had stayed home with hospice and we had provided support to these caregivers who are getting sick, getting tired, getting fatigued, and supported them to do this work and keep this person at home with hospice that really attends to the patient's experience in the home, which is where everybody wants to be, by the way. 80% of people want to be at home. So we have to do a better job supporting people to stay in their homes, supporting the around what hospice is already doing and allowing them to stay. It will be so much less money. And the same thing goes for employers, by the way. Do you know that employers lose $65 billion every year from caregivers, their caregiver employees missing, being late to, or change to work, changing jobs because there isn't enough flexibility. And it costs these employers a tremendous amount of money. And some of the more savvy employers, and now it's becoming more and more competitive, are creating, and this is very hopeful news, more benefits in their their EAP, their HR packages for family caregivers to support them in a variety of ways. And I think this is a really good trend. But employers are losing. It's just lose-lose situation. Couldn't agree with you more.
Thank you. Thank you. We have one more question. This is from Marjorie. Marjorie, you're on.
Hi, sorry about the lack of a picture, internet problems today. So I'm part of an organization called the Caring Majority, and in New York State, we advocate for home care workers, family caregivers, and anybody involved with the home care industry. One of the big problems is a lack of home care, qualified home care workers, and that leads to the pay and benefits issue. And I was wondering if you see the Biden administration as an administration that will be more open and willing to acknowledge the need of a home care workforce, because this is also an issue. People cannot afford home care workers, so they become the family caregiver. But if they had support from the government, then maybe they wouldn't have to be the family caregiver. I recently made some phone calls about a petition that's currently for New York State about increasing wages. And I spoke to a woman who said she is taking care of 2 twins with cerebral palsy by herself, and she receives $12 an hour from the government. So, this is a larger issue, tangential to, the issue about what matters, which is also very important.
Well, I'm so glad you brought all of this up, because it's critically important to understand, first of all, what is happening legislatively going forward, and to sort of acknowledge this issue of professional hired caregivers and and their experience as well. The good news is I really think Joe Biden cares about this issue. Obviously, Joe Biden was a family caregiver many times. For his parents, for his son, and for his children when his wife died with his daughter. And he, right from the very beginning of his campaign, has been talking about really prioritizing caregivers. He's got this big plan, $775 billion that he's proposed, which is not only for informal family caregivers. I don't even know, a lot of people don't like that term informal, but the family caregivers themselves, but it also includes the actual people who are professional caregivers as well, and people in the who for younger children with disabilities. But he really has what people are saying might be a pretty robust set of desires to put into law to improve the support to family caregivers. And that includes things like tax benefits, expanding Medicaid, putting more community health workers on the streets. I think he is talking about 150,000, and those are people who are sort of advocates, particularly for low income families, to help them understand sort of the resources that are out there and help them kind of make their way through this confusing landscape. I think this idea of, he wants to make family medical leave, that 12 weeks of family medical leave, which, by the way, he was one of the signers in 1993. He wants to make it paid. It's been unpaid, which all of these things will help. He wants to give put money into SSI for family caregivers if they can't be working because they're doing this other job, and make sure that they're not losing out on their SSI benefits. So there's a lot of stuff that he's talking about. I think a $6,000 tax credit. I mean, a lot of stuff that could be very, very helpful to family caregivers. I think your point about you know, the fact that it, first of all, for families, it's very expensive, obviously, to hire a paid caregiver. You had said $12 an hour. Is that for that was in-home support services for the family member to get paid by the government, or was that to hire somebody else?
No, this is a woman who was taking care of her 2 children.
And she was getting it, right.
And it was through another organization that she received this stipend because it was a full-time job.
Yeah.
Can you imagine taking care of 2 twins with cerebral palsy for $12 an hour? It's
no way. And that's, I mean, here in California, and I'm not sure if you have this in New York, but we have a program through Medicaid for low-income families that's called IHSS, in-home support services. Do you have that in your Medicare or your Medicaid program? Anyways, people get paid minimum wage, and because it's not enough to hire a professional caregiver who costs $30 an hour. So they just end up having to take the money themselves, do the work themselves, but it's compensating them who are already so burnt out, and they still can't reach out with that money and get more support to come into the home. So it's inadequate right now. It's really we've got to change all of these policies. And I hope Joe Biden is really going to do something. People seem to think there's a chance.
This is such an important and fascinating conversation. I want to urge everyone here. It's not always easy. What I love is that this is a short film. It's easy commitment. It's really accessible. And I urge you to tell all of your friends, or at least 10 of them, to check out this film. I think that's a great entry point. Of course, they could watch this conversation on our YouTube channel that will be associated with the screening of the film. I want to give a big shout out, of course, to What Matters. Check out whatmattersny.org to continue this conversation, continue engaging. Sally, did you want to say anything? You have to
well, I'm the director of What Matters, and I appreciate that this conversation and all that Jessica has brought to it in terms of, you know, her whole profession and her past and her writing and now these films, it really just brings to the fore everything that we're trying to convey to the public. So I thank you, Jessica and Lois, for a beautiful job of not only being a What Matters volunteer, but bringing this film to us. And thank you for this opportunity. And if anybody wants more information about our program, I put our email address in the chat. So we look forward to hearing from you.
Jessica, where can people find out more about the film?
Excuse me. We have a whole variety of screenings coming up, and the film is not yet released for public viewing, but if you want to see it, you can go to our screenings page at caregiver.alovestory.com, and you'll see where it's screening around the country. And hopefully one day we'll have a platform for it to be living on, and then you can all watch it whenever you want to.
Thank you. Lois, thank you for leading this conversation and being a part.
Thank you for the opportunity. Thank you, Jessica, for sharing your remarkable self and work and knowledge and not so accidental activism with us. We're really grateful. It was very rich. And again, while the movie is screening, please all go see it on the website. It's very powerful, as you can all imagine.
Thank you. Thank you, Jessica. Thank you. This will be available all week. Please join us. Tell your friends. Stay safe. We want to see you in person soon. Get your vaccines. And thank you very much.